Hello, in this presentation, I'm going to be discussing the healthcare systems of the US, Japan, and Brazil, as well as suicide in these three countries. Starting off with the United States, I'm not going to go over all of this, but the GDP is first, and the life expectancy and infant mortality rates are pretty good. The United States healthcare system is complex and incorporates the Beveridge, Bismarck National Health Insurance and out-of-pocket models. Moving on to Japan, its GDP is lower, ranked fourth. However, life expectancy and infant mortality rate are significantly better there. The healthcare system follows the Bismarck model, and it is regarded as a great healthcare system, acquiring universal healthcare coverage in 1960. However, Japan has fewer medical professionals, and this can make medical treatment slower. Moving on to Brazil, its GDP is the lowest of the three at ninth. Its life expectancy, infant mortality, and percent living in poverty are significantly worse than that of the US and Japan. Its system is known as the SUS and is a national health insurance model healthcare system. However, it provides lower quality care, so some families choose to seek private healthcare. Now, using the quad model, you can see that the United States is much more complex when it comes to financing, insurance, delivery, and payment, whereas in Japan and Brazil, you kind of know what you're going to get. The government's going to be a lot more in control of the healthcare there. Some of the pros of the United States are high quality care and various options. However, the system can be complicated. And with Japan, it's going to be a great system, very affordable, and has universal coverage. However, with the aging population, it can be hard to get into hospitals and receive that care. And then in Brazil, again, it's going to be very easily accessible and it's going to be free healthcare to the public. However, that quality of that care is going to be lower. Now moving to my health issue of suicide. Suicide is the act of intentionally taking your own life. There are a lot of factors that play into it, such as mental health disorders, substance abuse, discrimination, and chronic stress. The United States and Japan's suicide rates are decreasing while Brazil's are increasing. And Brazil actually has the lowest suicide rate of the three, while Japan has the highest. And I just want to note here that the amount of money the country has does not correlate to suicide rate at all, which I thought was interesting. Looking at disparities, both in all three countries, men were more burdened by women. In the United States, individuals 85 and older were more at risk, whereas in Japan and Brazil, younger and middle-aged populations were more at risk. So what is being done in the United States? The 2024 National Strategy for Suicide Prevention was released, which looks at suicide with an upstream approach. It focuses on connecting people within communities and decreasing access to things like firearms. Additionally, it emphasizes research on suicide, making it more of a public health priority, and destigmatizing suicide, making it okay to have that conversation. In Japan, they split things into primary prevention and secondary preventions. Primary prevention is going to be things more like raising awareness and training professionals to have talks with people about suicide. And secondary prevention is going to be things like screening to see who's at higher risk. Japan also uses this method called the assertive case management, and they use these following strategies and apply them to people who have previously attempted suicide. And what this does is actually decreases the likelihood of them trying to commit suicide again. In Brazil, they're trying to catch up to what the countries such as US and Japan are doing. So they're advocating for more intervention focused research, trying to figure out what they can do with the research they have and apply it to decreasing suicide rates. They are also looking for more of an upstream approach, like with what the U.S. is doing, and they're also trying to train their medical professionals and improve the screening efforts to see who is at higher risk of committing suicide, like with what Japan is doing with the primary and secondary preventions. Some challenges that come along when dealing with suicide as a public health issue. Number one, there's no primary cause for suicide, so it comes from mental disorders and socioeconomic status, and just so many other factors of people's lives. It's really hard to track, and it's really hard to deal with. Additionally, various healthcare sources are needed, and when these healthcare resources try to come together or try to share information, can get a little confusing. And then lastly, lack of adequately trained healthcare workers. So when physicians or other medical professionals don't know how to bring up suicide, it can create a stigma, and people might just keep those thoughts to themselves until they actually end up committing the act. Lastly, I just want to give credits to AI for helping structure my bibliography. Thank you. Have a great rest of your day.